Let's take a listen to a young lady who has a strangled voice or worse, diagnosed by one of the foremost ear, nose, and throat doctors in the country. She will tell her story. She was given 2 Botox shots, and she was left with bowed vocal cords. It's with the best of intentions. It's a compassionate approach. It's humanitarian. It's looking to produce a quick fix. But the problem is, as you'll hear the voice, what the outcome is. Let's listen to this young lady. You're listening to a voice that shows not only a strangled strain, but an extreme breathiness. That's from Botox shots. Botox does various things to different people. It's an attempt to quick fix the strangled voice. The outcome can be a roller coaster ride, which is usual after you have the Botox shot. They usually put the vocal cord dosage in an experimental mode. They're not sure what the dosage should be. That despite the fact that the flick or the video on treatment of this condition by the National Spasmodic Dysphonic Association says that the dosage is precise. From my experience and from understanding what goes on in the country, it's not so. Let's take a listen to the new voice.
Well, and then he says, well, how long ago did you see Dr. Cooper? And I went, oh my God, it's been 6 years. It'll be 6 years in June. And I was like, well, you got me all stirred up again now. I said, I could tell you about the hypnotist I went to, about the chiropractors, about the doctors who even refused to treat me.
She uses that voice on the phone, which is the most difficult attribute for those who have SD. She has a perfectly normal voice. It's 6 years since she has had this cured voice. She's been on national television. It's very interesting to realize that the strangled voice, even with the worst of outcomes or the most impairing of outcomes, leaving the patient with bowed vocal cords, can be overcome by direct voice rehabilitation, which is all natural. I've been reporting cures of bowed vocal cords for years and years, and she had bowed vocal cords. The physician and ear, nose, and throat doctor, famed in his own right, as I indicate, is well-intentioned, humanitarian, compassionate, but I believe they're on the wrong road in treating spasmodic dysphonia of the strangled voice with whether it's Botox or surgery or speech therapy, and not allowing the patient to have choice of treatment, which is a modality called direct voice rehabilitation, which is the only modality and only approach in the world reporting ongoing cures of this condition by all natural approach and means. She is a very outgoing person at this point, having had her voice back. But had she not gotten her voice back, as a number of individuals who have suffered strangled voices, whether treated by Botox or surgery or speech therapy, may indicate and may reveal that their social lives and their careers are affected with the best of intentions from the medical community. What is the answer to the treatment of this type of voice, the strangled voice? Is it not to provide a choice of treatment for those who have spasmodic dysphonia? The famed New York Times has indicated that Botox is giving back those with spastic vocal cords their voices, but it doesn't tell you what kind of voice the individual gets back. And in this case, you hear what the outcome was, and it took a period of time to get her voice back to where it was cured. Let's take a listen to the next patient.
I got laryngitis, and after that I rested for about 10 days, and I did not teach I did not teach for 10 days. But after I recovered from laryngitis, I began my usual load. I began teaching my usual load. And from then on, this became gradual with me.
This is a young man who had severe spasmodic dysphonia, was diagnosed by Hans von Leyden, one of the foremost ear, nose, and throat doctors in the world. And Hans von Leyden was recently honored for his contribution to the field of voice pathology. And it was my pleasure to have been associated and work with him at UCLA Medical Center some years back when I was on the staff and later on the faculty at the UCLA Medical Center and Head and Neck Division. Hans von Leyden was honored by Cedars-Sinai, as I indicate, for his outstanding services to the field of speech pathology. And the question comes up, is the diagnosis of SD, spasmodic dysphonia? In the previous case, the ear, nose, and throat doctor is one of the foremost in the world as well. And in the previous case with the young lady, was diagnosed at Scripps by the foremost ear, nose, and throat doctors available to treat and diagnose spasmodic dysphonia. The point I'm making is spasmodic dysphonia is spasmodic dysphonia that I'm working on. And now we're going to listen to the voice that is cured of spasmodic dysphonia by what I do, direct voice rehabilitation.
I was told by you to practice and keep my breath and keep my breathing at the right time and use the right level and the right tone focus.
How long did it take you to do that?
Here it took about 1 year, but when I left Los Angeles, I had about 75 to 80% improvement. And I went back to it. First year I was teaching, I had a little problem, but starting the second year, I gained full recovery.
This is a gentleman who has been cured of spasmodic dysphonia or spastic dysphonia, you can use either term in this case, for approximately 25 to 30 years. He remains asymptomatic, and it's a pleasure to tell you that spasmodic dysphonia is curable by direct voice rehabilitation. Let's take a listen to a young man who is diagnosed with spasmodic dysphonia by the Mayo Clinic, and he was treated with Botox by an ear, nose, and throat doctor. But let's hear his story and his voice with the Strangled voice.
Ronald Steger. Okay, how long have you had this condition? A year and a half. Okay, was it sudden onset or gradual? Just... What do you do? We're trainers for Herbalife International. Ronald Steger. Okay, how long have you had this condition? A year and a half. Okay, was it sudden onset or gradual? Just... What do you do? We're trainers for Herbalife International.
And now we're going to take a listen to his story. He was not happy with his treatment, and you're going to hear a mid-level treatment that he describes his condition with direct voice rehabilitation, and then we'll wind up by explaining that he has a normal voice, and he says so, and he finds he's cured of the condition called spasmodic dysphonia. Let's take the mid-level treatment.
My first consultation, he taped me like he did here, and he diagnosed me with spasmodic dysphonia, and he gave me 3 choices. 1, Botox shots, 2, surgery, 3, live with it. And I decided to try the Botox because he highly recommended that. It helps a lot of his patients get rid of their spasms in their neck. Mm-hmm. I would be real breathy for like 6 weeks where I could just whisper, like, hello, how is it out there? And I still had a hard time talking. What's that?
Did you have to take deep breaths to get your voice?
Yes, I had to take a deep breath, even to whisper. And
Because the
then,
vocal cords were paralyzed and the air was going through.
Yeah.
And then did you get a normal voice or did you get some
Then
voice?
I would get like a almost normal voice, but it was not like it is now. And then I would go right back to the way I sound on that tape, back to spasms, and I have to go back in for more shots.
Where were the doctors? Where are the medical centers?
Well, the first one I seen was Milwaukee, Frederick Medical College, Dr. Albert
A great
Murati.
medical center?
Yes.
Who was the doctor?
Dr. Albert Murati. You know, he had all this medical equipment, an arm full of doctors, white coats, and I believed him. When he told me this is for life, there's no known cure, there's Botox, surgery, or live with it, I believed him. And then I went to another clinic because I wasn't satisfied with the results I was getting with him for 6 months, so I went to Minnesota, the Mayo Clinic in Minnesota, and I seen Nicholas Margos, and he looked at me and evaluated me and said the same thing: spasmodic dysphonia, surgery, Botox, or live with it, Ron.
This young man had 5 Botox shots, and he was not happy none of them were doing the job for him. Despite the fact that Botox is said to be 99% effective, I don't believe that from clinical experience. They're well-intentioned to say that. The medics tell the patients that Botox is the state-of-the-art treatment of choice. They sometimes forget to ask for whom it is the treatment of choice and for whom it is the art. So here you heard a young man who had a pretty good voice, and you wouldn't suspect that he had spasmodic dysphonia. But that was midterm, and now let's take a listen to his voice as he's describing how he feels now.
And he says, well, Ron, I'll give you 3 options too. He says, you can continue coming here for shots. You can call that doctor in California to schedule a surgery if you'd like. And then he goes, oh yeah, by the way, Ron, there's also this other guy. Go to his website, and he wrote down his name, thevoicedoctor.com, and handed it to him, and he says, check out this guy. He says he has a cure. And go home and let me know what you decide to do. Think about it, he said, before you plan that surgery. So I went home, went to the voice doctor right away, because here's somebody that he said that has a natural cure for it. And I go to his website, and here there's 14, 15, maybe more than that now, testimonies, people with spasmodic dysphonia, and then after a year, or some people 6 months, of direct voice rehabilitation, and they're talking. And they sounded just like me, you know, can't count from 1 to 10, can't say your name. And here they are after seeing Dr. Warren Cooper, they're talking. Once I understood how to start using my voice correctly and breathing correctly, my voice started coming back to me. And it's amazing. I mean, I couldn't believe it. And I stayed with him a week, and went home. He had diagnostic sentences for me, voice exercises, breathing, and a schedule. Started in the morning, afternoon, evening, continually do these voice exercises until it was better. And it's amazing. Here I am today, talking normally. I go to church, I can sing, and it's amazing. Besides having surgery and Botox shots, it's a great option. I'm glad I went to him and found a cure for my voice, a natural cure, and it's great being able to talk. And I'd like to thank you again, Dr. Cooper, for what you do for society, and I'm very thankful for you, and God's blessing for you, and it's amazing talking normal, and I can't say enough how much I love wanting to help someone else find their path or journey to getting a corrective voice. It's fantastic.